Good evening to everyone and welcome to today's session. Yesterday I was in Raipur to meet the students in Jawaharlal Nehru Medical College. So, wonderful students in Raipur, enthusiastic to win the exam. So, yesterday I am missing all our online students everywhere. So, we are truly lagging behind in anatomy. We will try to cover up. We welcome our online friends Neena, Vikas, Rohit, Jabalpur, Satya, Brahmaramba, Vizag, Tirupati, etc. etc. See, anatomy has become a deep forest. Any amount of cutting is not enough. What we shall do is today we will mark it as a day to end this series of batting of the 5-day match kind of anatomy. But what we shall do is from tomorrow we will have a subject test, discussion of the subject test, which is a physiology test basically according to the schedule. From Monday onwards we shall have physiology started, and every day half an hour extra, half an hour to 1 hour we will try to cover up extra whatever that we are leaving behind anatomy. Then that will give us a little more energy to feel that we are not too much dragged over. So let us make the great beginning. Lower limb, mainly we need to know the lower limb bones, the lower limb joints, the lower limb nerves, the lower limb vessels. This is how we basically approach the lower limb in anatomy, on which a lot of questions come. So, in the lower limb bones, we have the hip bone. Please let me know, is the voice clear? Dr. Priya, Kavita, Shahila, Vidya, I hope the voice is clear to everybody. Huh? So, the hip bone is formed by the fusion of the ilium, pubis, ischium, and typically it articulates with the sacrum at the sacroiliac joint is what need to be remembered. Then in the pubis, we have ilium, pubis, ischium. So, typically the obturator foramen is formed by the fusion of the ischium with the pubis. And what is ischium? Ischium basically has one ischial spine, ischial tuberosity, and a lesser sciatic notch are the important landmarks to be remembered. Then what is acetabulum? Acetabulum is fundamentally a incomplete cup-shaped cavity on the lateral aspect of the hip bone, where the head of the femur will be fitting into it, and there is one transverse acetabular ligament which will convert this cup-like acetabulum into a cavity. And what constitutes the acetabulum? It is the ilium superiorly, ischium postero-inferiorly, and pubis anteromedially combined to form the acetabulum. So these are the important landmarks, because origin insertion of the various muscles, we are going to ultimately go around through all these landmarks. Now, if you look at the femur, femur is the longest and the strongest bone in the body. Our anatomy teacher told us in the first day. The femoral head basically is 2/3 of a spear. And how is it directed, doctor? Medially upward and slightly forward to fit into the acetabulum. So here you have a capital femoral epiphysis and a growth plate, and the metaphysis, which is very rich in blood supply. So these are the important landmarks when it comes to the hip joint. Now, typically the head of the femur, if you take, it has a depression in its articular surface with the acetabulum. This is the head, this is the acetabulum, which is called as fovea capitis femoris. to which the ligamentum capitis femoris is basically attached. What is the importance of the ligamentum capitis femoris? Because that is the source of the blood supply, nutrient artery. Basically passes through that. That's the reason we need to fundamentally remember. Then what is femoral neck? One of the common question in the exam. Typically the femoral neck forms an angle of about 125 degrees with the shaft. If it is less than 135, you call it as, if it is less than 120, you call it as cogs of error. If it is more than 135, you call it as cogs of valga. So these are all the standard questions in the exam. Now, typically the head is separated from the shaft in the anterior aspect by a line called Intertrochanteric Line. What is the importance of it? One of the very strong ligaments in our body, iliofemoral ligament, basically takes an origin from the Intertrochanteric Line. That's the reason we need to remember in the anterior aspect of the femur, the Intertrochanteric Line is what we need to fundamentally remember. So doctor, we have a head, we have a greater trochanter, lesser trochanter, between them an intertrochanteric line. Till there we reached the story. Now what do you want to remember about greater trochanter? Basically greater trochanter is the most important point of insertion for a lot of muscles of the hip. Gluteus medius, gluteus minimus, piriformis, obturator internus. All these typically have got an insertion onto the greater trochanter is what you need to remember. So this is how all the muscles will come of the hip joint and ultimately merge onto the greater trochanter. Hence it is called the trochanter the greater. And also it receives the obturator externus tendon also on the medial aspect of the trochanteric fossa. So these are the classical landmarks. This is the iliac crest, this is the anterior superior iliac spine, this is the anterior inferior iliac spine, and this is the area where the greater trochanter, where all these muscles are merging. These are the classical surface landmarks. Then what is the importance of lesser trochanter? Who inserts and originates from it? Is one of the important question. Typically, you all know iliopsoas, no? There is one iliacus muscle and psoas, major, minor. They typically insert on the lesser trochanter. This greater and lesser trochanter insertions, lot of times in exam, the questions have been asked. So that is the reason you have to be 100% clear on greater trochanter who is inserting, on lesser trochanter who is inserting. You need to be very, very precise. Then comes the linea aspera. Typically it is a rough line or ridge on the body of the femur, that is the shaft of the femur. It has got one lateral lip, medial lip. Lot of muscles typically have an attachment, and even the intermuscular septum has an attachment onto this long groove which is called as linea aspera. Now this gives a typical picture, unforgettable. We have an area where you have greater tuberosity. Greater tuberosity. Then we have one pectinial line in the middle. Then we are having one spiral line. Then we have the medial lip of the intertubercular of the linea aspera. Then we have a lateral lip of the linea aspera. So these are the typical structures which should not be forgotten when it comes to the anatomy. Now who attaches to each of these areas of the linea aspera, etc., etc.? Let us look into it. Once more, all the muscles basically merge on and take an insertion onto the linea aspera. Another important place where all the main muscles come and merges onto the two trochanters. So that's very important. Now, we said there is a line called Pectinial Line. Where is that? Typically here we are having a pectinial line, right? Who basically inserts onto it, as the name itself says, pectineus muscle is the one which inserts onto the pectinial line. There is one more important landmark in the femur which is called as Eductar Tubercle. Where is it located, doctor? Typically on the medial femoral condyle, there are two condyles, medial and lateral femoral condyle. On the medial femoral condyle, we have this prominence which is called as Eductar Tubercle, onto which the adductor magnus muscle is the one which is inserting. Now let us take up few comments on patella. What is the most common question asked about patella? The largest sesamoid bone in the body is the patella. It is the tendon of the quadriceps femoris in which this patella is located, and it basically articulates with the femur, but not with tibia. Many people think it will articulate with both the femur and also tibia. You can check your own patella. It doesn't insert onto your tibia. If it inserts onto your tibia can't be free to move anywhere. But the tendon, you have that quadriceps tendon. So the tibial tuberosity on the tibia and the patella, both of them are connected by the continuation of the quadriceps tendon, which is otherwise called as patellar ligament. So whenever you are eliciting a patellar reflex, where are you tapping, doctor? You are tapping on this patellar ligament, which is leading to the stretch in the quadriceps, and that stretch must cause a reflex contraction of the quadriceps. That's how whenever you elicit a patellar reflex, you should check for the contraction of the quadriceps. Of course, we examine for the jerk of the leg. Otherwise, whenever the quadriceps contracts, the leg will be jerking, whichever the way you want to. So this is the anterior surface and posterior surface of the patella. On the back of the patella, posterior surface, you have one lateral and medial facets. Now, what is the function of patella? It is a sesamoid bone. Why do we need that? Typically, the strong muscle called as the quadriceps, whenever it is contracting, it has a chance to lead to wear and attrition on the femur. Whenever it is roughly rubbing against the femur, whenever our thigh is contracting, that is basically prevented by this. Then also, it will lift. See, if the patella would not have been there, what this quadriceps would have been? Directly it would have passed on the femur and got inserted onto tibia. But in the middle, a patella hone ke wajah se, because of the patella, it lifted the patella and increased the mechanical power of the quadriceps, is another important purpose. That's all about patella, the largest sesamoid bone. Then what you want to remember about tibia? Tibia is that weight bearing medial bone, as all of you know. It has one tibial tuberosity on which patellar ligament inserts. Tibia also is having a medial and lateral condyles which articulate with the respective medial and lateral condyles of the femur. So you can see there is one medial condyle, lateral condyle, intercondylar eminence, tibial tuberosity, and an anterior crest of the tibia whose medial malleolus is typically hanging down. Then fibula. Fibula has got a head and it has contributes to the lateral malleolus. Now, doctor, very important thing when we talk about tibia is the grooves that the tibia is having. Typically, if you look at the medial malleolus is a part of tibia. It has one malleolar groove, and through the malleolar groove, who will be passing, doctor? We need to remember two important muscles. One is tibialis posterior. This is the tibialis posterior. Other is the flexor digitorum longus, this is flexor digitorum longus. These two will be passing through the malleolar groove, which is a medial groove on the medial malleolus of the tibia. Then there is one more groove which is posterolateral to this malleolar groove, through which the flexor hallucis longus will be passing. And we also need to remember the malleolar groove because it is this which provides the attachment for the deltoid ligament. One of the very important ligaments along the medial aspect of the foot is what you need to remember. That's all about tibia. Then with regard to the fibula, fibula has a very little or a no function in weight bearing. If I remove the tibia, fibula also you can nicely participate still in the Olympics as a sprinter. But if I remove tibia, you can't. So, it provides attachments to the muscles. It has got a head. And head need to be remembered because you have one fibular collateral ligament along the knee joint. Typically, the head of the fibula provides attachment to this fibular collateral ligament is what you have to fundamentally remember. Then, there is a projection in the lower end of the fibula called lateral malleolus. Why it need to be remembered? Lateral malleolus articulates with the talus. You have a talus, no? Talus has one area called trochlea. To the trochlear part of talus, this lateral malleolus basically articulates. And if you compare medial malleolus of the tibia and the lateral malleolus of the fibula, the lateral malleolus of the fibula is more inferior, more posterior than the medial malleolus is what need to be remembered. What was the question asked in the recent AIMS exam? AIMS May 2013 question paper we have discussed. If you missed it, it is made available on the YouTube on youtube.com/onlinembbs. Simplest question asked by examiner was puborectal angle में कौन रहेगा? Sorry, anorectal angle में, anorectal angle. You have anals which has an interlexal sphincter, you have the rectum and a puborectalis muscle. Anatomy questions can be simple. If you know that lateral malleolus belongs to fibula and medial malleolus belongs to tibia, half anatomy you know. On the top, if you know medial malleolus has a groove, gold medal. So be very sure of that. Now, if you look at the lateral malleolus, what structures basically attached to it? There is one anterior talofibular, posterior talofibular, calcaneofibular. These are the three ligaments which basically attaches on the lateral malleolus is what we need to remember. Then, agar medial malleolus is having a groove for the passage of the tendons. Which tendons? Flexor pollicis longus, etc. Right? Then what does lateral malleolus is having a groove? It will say, I too want a groove because you gave a groove to the medial malleolus. Through that groove, peroneus longus, peroneus brevis are the two important tendons which will be passing. So let us summarize, doctor. We have medial epicondyle, patella, tibial tuberosity, anterior crest of the tibia which is subcutaneous. Then we have a medial malleolus, lateral epicondyle of the femur, head of the fibula, lateral malleolus, calcaneum, the classical surface markings. Now let us talk about the foot, tarsus. Tarsus is having 7 tarsal bones. What are they, doctor? We have one talus, you all know. Talus is bearing like Atlas. The weight of the entire body falls on the talus, on which tibia is sitting on the head of the talus. There is a calcaneus on which we will be landing on a dance floor. There is a navicular bone which is like a boat, cuboid, and 3 cuneiform bones. So this is the typical tarsus. Each of these bones 1, 2 comments. I think too much anatomy is too bad to health. Thallus. Why do you want to remember? It transmits the entire weight of the body from the tibia to the foot. This is the thallus, this is the tibia. It transmits the entire weight down. And if I ask you an MCQ, the only tarsal bone without any muscle attachments. So the thallus told the god while creating, पूरा weight bear करने का responsibility दो, or you give me attachments. If you give attachments, I don't bear the weight. If you ask me to bear the weight, I should not have attachments. God said, okay thallus, no muscle attachments to you, but you need to bear the entire weight. That is the deal between thallus and the god. Thallus has got a neck with a deep groove, which is called as, the thallus has got a neck with a deep groove, which is called sustentaculum, the sulcus stelli. Sulcus stelli. So what is the purpose of this sulcus stelli? There are some ligaments which are passing between the thallus and calcaneus, no? So when they are passing, they need a little space, groove in the thallus, which is called sulcus stelli.